Do you feel empty inside, even when everything seems normal? Then you should know signs of high-functioning depression and clinical depression. Welcome to the Psychology and Physical Training channel. Depression resonates with you. You might be experiencing what's known as high-functioning depression. It's a term that's been making rounds on social media, painting a picture of individuals who carry on with their day-to-day tasks, yet are gradually feeling less joy, experiencing a sense of emptiness, and losing interest in social activities. It's important to note that high-functioning depression is not a clinical diagnosis, but rather a term used to describe a state that might be a precursor to depression. It's a hidden struggle, a silent battle that many are fighting without the world knowing. So if you're feeling this way, remember, the best time to work on your mental health is as soon as you notice these changes. Signs of high-functioning depression. High-functioning depression may seem invisible, but there are signs to watch out for. This form of depression is a paradox, an enigma. You're doing everything you're supposed to do, you're keeping up with your responsibilities, but inside there's an unshakable emptiness, a void that you can't quite put your finger on. This is the first sign. You feel empty inside, even if you're fulfilling all your obligations. Another sign is a loss of interest in social activities. You might find yourself pulling away from your friends and family, not out of malice, but because it feels like too much effort. You may even feel numb, a sense of detachment from the world around you. The things you once enjoyed now feel like a chore. You're just going through the motions, doing what's expected of you without any real passion or joy. And then there's the use of distractions to numb the feelings. You might find yourself mindlessly scrolling through social media or watching hours of TV just to escape the emptiness. You might turn to junk food, not because you're hungry, but because eating is a distraction, a temporary relief from the numbness. Self-neglect is another common sign. When the high functioning ends, when no one is looking, you might neglect your physical health, your mental well-being. You might stop caring about how you look, about what you eat, because you're too consumed by the emptiness, the numbness. Recognizing these signs is the first step towards seeking help and recovery. High-functioning depression might not be a clinical diagnosis, but it's a real struggle that many people face. It's a silent battle, one that's often fought behind closed doors, away from prying eyes. But it's important to remember that you're not alone, that help is available. So if you're feeling empty, if you're losing interest in the things you love, if you're using distractions to numb the pain, if you're neglecting yourself, reach out, seek help. It's okay to not be okay, and it's okay to ask for help. Understanding clinical depression. Clinical depression, on the other hand, is a medical diagnosis with specific symptoms. It's a pervasive mental health disorder that affects every aspect of a person's life, from their thoughts and feelings to their physical health and daily activities. For instance, one of the hallmarks of clinical depression is a persistent low mood. This isn't just about feeling sad or down for a few days. It's about experiencing a deep, unshakable sadness that lasts for weeks, months, or even longer. Another sign is a loss of interest or pleasure in activities that you once enjoyed. You might find that things you used to love doing now feel like a chore, or that you simply can't muster the energy or enthusiasm to engage with the world around you. Disturbed sleep is also a common symptom. You might find that you're sleeping too much or not enough. You might wake up in the middle of the night and struggle to get back to sleep. Or you might feel constantly tired, no matter how much you rest. Changes in appetite and weight can occur too. You might lose your appetite and start to lose weight, or you might find yourself eating more than usual and gaining weight. Fatigue and a loss of energy are also common, making even the simplest tasks feel like an uphill battle. You might also experience agitation or slowed movements, a sign that your body is struggling to keep up with the demands of daily life. Poor concentration and indecisiveness can make it hard to focus and make decisions, even about small things. This can lead to feelings of worthlessness or excessive guilt as you start to believe that you're not capable or deserving of happiness. Finally, clinical depression can lead to suicidal thoughts or urges. This is a serious sign that you need immediate help. Clinical depression requires medical intervention, and it's important to seek help if you're experiencing these symptoms. You don't have to face this alone, and there are many resources and professionals who are ready and willing to help. High-functioning depression versus clinical depression. High-functioning depression and clinical depression may sound similar, but they are different in several ways. Let's delve into these differences to gain a clearer understanding of these mental health conditions. High-functioning depression, as we've mentioned, is not a clinical diagnosis. It's a term often used by individuals to describe their experiences of maintaining normal daily routines and obligations, while internally struggling with feelings of emptiness, disinterest, and emotional numbness. This type of depression may not necessarily hinder one's ability to function on a day-to-day basis. However, it's a constant battle to keep up appearances, and the emotional toll can be immense over time. On the other hand, clinical depression, also known as major depressive disorder, is a medically recognized condition. It's characterized by persistent feelings of sadness, loss of interest in activities, and a significant decrease in energy levels. These symptoms are severe enough to interfere with one's daily life, making it difficult to work, study, eat, sleep, and enjoy time with friends and family. Clinical depression requires medical intervention, often involving a combination of therapy and medication. While both high-functioning depression and clinical depression involve feelings of sadness and a lack of interest in activities, the intensity and impact on daily life are what set them apart. High-functioning depression is like a silent struggle, often unrecognized by others, as the person suffering continues to meet societal expectations. Clinical depression, however, can be debilitating, making it impossible to carry on with regular routines. That being said, it's important to remember that mental health exists on a spectrum. It's not simply a matter of being clinically depressed or not. Individuals may experience a range of symptoms and severity, which can fluctuate over time. Regardless of the label, if you're struggling with your mental health, it's crucial to seek help. Recognizing your feelings and reaching out to professionals or trusted individuals in your life is the first step towards healing. Remember, there's no shame in asking for support. You are not alone in this journey. Conclusion: depression can manifest in different ways, and it's not always visible to others. As we've traversed the terrain of high-functioning depression and clinical depression, it's strikingly clear that both bear their unique challenges. High-functioning depression can be especially deceptive, often concealing the suffering behind a mask of normalcy. On the outside, individuals may appear to be managing their lives effectively, but on the inside, they grapple with feelings of emptiness, apathy, and a dwindling interest in life's pleasures. In contrast, clinical depression is more overt in its presentation. It's marked by a persistent feeling of sadness or hopelessness, a loss of interest in activities usually enjoyed, and physical symptoms that can be debilitating. Yet, regardless of the form it takes, depression is a serious condition that requires attention and care. The key to understanding your mental health is self-awareness. If you find yourself ticking off the signs of high-functioning depression, feeling empty inside despite keeping up with your daily responsibilities, or if you're experiencing the hallmark symptoms of clinical depression, it's essential to take the next step. Reach out to a mental health professional, confide in someone you trust, or tap into the numerous online resources available today. There's no shame in admitting you're not feeling your best. Navigating the waters of mental health can be daunting, but remember, you're not alone. There's a whole community of people who've walked in your shoes and a wealth of professionals ready to provide the support you need. Recognizing the signs of depression, whether high-functioning or clinical, is the first step towards healing. Depression doesn't discriminate. It can happen to anyone, and it's not a sign of weakness. It's a part of the human condition, a testament to our capacity to feel deeply. But with the right help and support, it's also something that can be managed. Remember, it's okay not to be okay, and seeking help is a sign of strength, not weakness. And if you like this video, do not forget to subscribe and follow the Psychology and Physical Training channel for more videos. Thanks for watching.